Hello, everyone. Dr. Ibe Nathans once again. I know we are all doing very well. I have been having night sweats and temperature, feeling a bit unwell. What do I do, doctor? I have spoken to this person, and that was yesterday, and I've told her what to do regarding her night sweats. Now, all forms of night sweats, accompanied with temperature, feeling unwell, hot and cold, really needs to be investigated. It may be a normal night sweat. It may not be anything. It may not mean anything serious. However, it could be concerning as well. First of all, we need to exclude things like menopausal symptoms that can present in the form of night sweats, feeling hot and cold, and in women going through these menopausal phases. We need to exclude things like anxiety that can present with night sweats and sometimes palpitations and feeling that you cannot breathe. We need to look into the person's drug and alcohol intake, because high alcohol intake can equally cause night sweats. And we need to look into the person's medication history, like things like antidepressants, some steroids, or some painkillers can indeed cause night sweats. And equally, we need to check for hypoglycemia, which means low sugar level, which can present with night sweats as well. Having said that, all night sweats, as I mentioned earlier on, with temperature, weight loss, losing weight, and feeling unwell, are indeed very concerning, because we need to check for things like TB, tuberculosis. Some of the signs or symptoms of tuberculosis could be night sweats, weight loss, and feeling unwell. We need to check for HIV. HIV as well can present in the form of night sweats. And then we need to check for some sort of cancers. One of the most common cause of night sweats when it comes to cancer is lymphoma. Lymphoma, which is a cancer of the lymph nodes, swellings of the lymph nodes that presents with night sweats, feeling unwell, temperature, weight loss. And it's even much more concerning when the person that has been having these night sweats comes up with unexplained infections from time to time. So these have to be investigated thoroughly. I know there are lockdowns, there are restrictions. However, just like I told my patient yesterday, the person that called me from somewhere, and I've told her what to do, she would get back to me today or tomorrow to let me know the outcome. So yeah, these have to be investigated. There are bloods that needs to be done, full blood count, thyroid function test, your inflammatory markers, and so forth and so on has to be investigated. Now, when it comes to this lymphoma, I remember about 6-7 years back, this patient came to me, and she just came for a health check and her medications. So as she was about going away, I noticed this swelling at the left side of her neck. I asked her, "Ma'am, why is that swelling?" She said, "Oh, don't worry, it's been there for some weeks now." Yeah, sometimes I sweat at night. In fact, I had to persuade her to undergo urgent investigations. I sent her for an urgent ultrasound scan. Unfortunately, it turned out to be Hodgkin's lymphoma. It was a lymphoma, which is a cancer of the lymph node. And so yeah, any swelling in the glands, neck area, groin area, any kind of gland swelling at all, accompanied with night sweats, temperature and feeling unwell, that needs to be investigated. Anything at all you notice in your body that is outside the norm, any symptoms that is not there in the past, not there before, don't trivialize it. Don't say it's nothing. Please make sure you contact your healthcare provider for further investigations or advice, or you get back to me if you want, really. Okay. In this period of COVID-19, please be safe, play safe, take care of yourselves, your loved ones, and family members. Be good. God bless. Bye.